Did you know that the numbness and tingling, maybe even pain you're experiencing in your hands and feet, could be connected to your gut health? Hi, my name is Dr. Karen May. Welcome to Everything Neuropathy. If you've watched any of our videos, you know it's my job to give you great information. It's also useless without an action step, but this does not constitute medical advice. But let's dive in. I want to talk to you today about something that might surprise you a little bit, the fascinating connection between gut health and neuropathy. Many of our clients are shocked when they tell me that they have all these gut health issues, and I'm like, yeah, that's a part of your journey with neuropathy, it can help them to experience that pain and numbness and tingling. And it's amazing because when we go deeper into their health history, they've had digestive issues for years, and no one's put that connection together. So let's start with some of the basics. Peripheral neuropathy is something that impacts over 20 million Americans, and it causes the symptoms like numbness, tingling. It could be pain. It may be balance issues. It could be in your hands, your feet, your face. So while diabetes may be one of the most common causes, please understand that there's over 100 different causes, and researchers are increasingly finding connections between gut health and nerve damage. So how exactly are your gut and your nerves actually connected? So it all starts with what scientists call the gut-brain axis. So this is a bidirectional, so it literally goes back and forth. It's a communication system between your central nervous system, which is your brain and your spinal cord, and what's called your enteric nervous system. That's all of the nerves that cover around our digestive tract. And so that's sometimes called the second brain. I'm certain you've heard of this. So when your gut microbiome, and this is the stuff, so don't forget, we're talking about small intestines, and this is the, like after you swallow food, get to through your stomach and get into the small intestines. It's supposed to look like tight-knit shag carpet, and it's the size of approximately a tennis court as well, all folded up in one cell layer thick. Well, on there we have this great microbiome, and my goodness, it is just, there's trillions of cells in there. And so understanding that when the system becomes irritated and agitated, it becomes imbalanced, and when that bacteria is no longer living healthily, it's called dysbiosis or gut dysbiosis. So this imbalance can trigger its own inflammatory response throughout your body, not just in your digestive tract, including even your peripheral nerves. So some of the groundbreaking studies that were published in the Journal of Nature showed that certain bacteria produce metabolites that either protect the gut and protect the nerves, or actually damage those nerves as well. And this can help explain why conditions like irritable bowel, celiac disease, and other digestive disorders can experience neuropathic or nerve pain type of symptoms as well. So let me walk you through some of those key mechanisms to gut health and neuropathy connection. First, it's absorption. So literally your gut is responsible for absorbing essential nutrients like vitamins, in particular B12, B6. There's just other nutrients in there that are necessary and crucial for nerve health. But when the gut is compromised and its function isn't working appropriately, even with healthy nutrition, you might not be absorbing all of the nutrients that you need to that are neuroprotective. So the second thing is the systemic inflammation. So this isn't just, hey, I sprained my ankle and it's puffy, or I'm bloated. This is systemic inflammation. If you have systemic inflammation, please understand it may show up as diabetes, it may show up as heart disease, it may show up as blood pressure, it may show up as constipation or acne, it could show up as asthma. So please understand systemic inflammation isn't just in your guts, and it's not just that you're being bloated. But the systemic inflammation means that an unhealthy gut allows bacterial products like lipopolysaccharides, it's a fancy word, but it enters your bloodstream, it gets outside of your digestive tract, and that triggers a response. And it's inflammation. It's your body's way to try to say, hey, this isn't correct, and trying to do its job. But this process is called metabolic endotoxemia, and it's been linked to both diabetic and non-diabetic polyperipheral neuropathy. So the third is actually immune system dysfunction. nearly 70% of our immune system resides in our guts. And so dysbiosis can lead to actually autoimmune responses where your body actually mistakenly attacks the nerve tissue instead of actually a true like immune system response. So this mechanism particularly is important in conditions like Guillain-Barré syndrome, chronic inflammatory demyelinating peripheral neuropathy. We're also seeing it with other infections that are going around. We're also, my disease process is called post-surgical neuralgic amyotrophy. It's also called Parsonage-Turner syndrome. This is the type of neuropathy that I had, where my body didn't like something during surgery, and my body attacked the nerves in my right and dominant arm. And in my condition, it was technically surgical, but it also can be vaccine-induced. It's good information and research how the condition I had was flu vaccine-induced or could be flu vaccine-induced. We're also seeing that now with COVID vaccine-induced too. So I follow into the autoimmune trigger side for what happened to me. So in our practice, please, I've seen remarkable improvements in neuropathy symptoms when we go and address the gut health issues. For instance, when I look at somebody and their digestive tract, I look at it like a burning house. So literally, if you're on fire, the first thing you got to do with the burning house is put the fire out and then seal up the house. Then you can clear out debris. Then you can rebuild the house. And that likens the gut too. So we can sometimes use probiotics, and there's great research showing how it can definitely help gut health, but that's also in the rebuild phase. So if you are too far down in the burning house phase, taking the probiotics may not be enough. So you've tried them and they're not just working. Just know you're rebuilding the house while it's still on fire. So let's talk about just some simple practical strategies that you can do yourself in order to help. First and foremost, food is medicine. Then we use supplements to supplement the gaps. And a lot of people are eating a very standard American diet that's highly, highly processed foods. And so those foods are literally just breaking down our body. So diversify what you are eating. Eat whole foods. So I have plenty of videos to go into deeper dive, but what you can do is, in order to have a healthy gut, you need good prebiotics. You don't need to take a bunch of supplements to do that. They're out there. You can buy them. But if we can eat them, think bananas that are more in that green to early yellow stage. Think asparagus, apples, actually onions, garlic. All of these are fantastic prebiotics that help to set you up for healthier digestion. You may consider taking a probiotic if you haven't tried it yet and you're early in this journey. And we want to look at lactobacillus and bifidobacterium strains. They have been shown to have some neuroprotective properties in some clinical studies. But we also want to reduce those highly ultra-processed foods. I love the author Michael Pollan. He has a book called Food Rules, I'm pretty certain it's called Food Rules. But one of the things he talks about is if the label has more than 5 ingredients, it's going to be highly processed. So even if it's healthy, it could be still highly processed. The other thing is if you look at that label, it's more than 5, or even if you can't pronounce the names on there, just a reasonable name like apple, orange, carrot, right? Very simple. If you can't pronounce it, more than likely it's going to be highly processed. So that is going to absolutely disrupt that gut bacterial balance. Alcohol, artificial sweeteners. Alcohol absolutely breaks down that balance. Artificial sweeteners, stuff like sucralose, there's enough research to know that it's an organochlorine. And organochlorine fits into a category of banned chemicals called DDT and PCBs. And so when you're eating stuff that has sucralose in it, it's literally damaging your digestive tract just to help to get that sweet tooth. So avoid all artificial sweeteners. So just remember that your body is an interconnected system, and we want improving your gut health. It can be simple, but it doesn't just improve digestion. It also creates an environment for a healthier functioning you. And that is what we're looking at, is to create a better functioning body so you can function optimally. So if you're experiencing any of those neuropathy symptoms, I encourage you to either give us a call, 517 883-2291, and we can get you more information and listen to your journey with neuropathy. So that way we can understand your journey, where you've been, where you want to go, and what options are available for you. If not, talk to your trusted medical provider too, and just don't allow someone to tell you there's nothing more that can be done. All it means is there's nothing more that they can do. So we look forward to hearing from you, answering your questions, and have a great rest of your day.